Welcome to today's presentation. I'm going to take you through 10 rights of a patient. Those working in the healthcare and those providing services, healthcare services, need to be aware of this. This training should even be done right from the training schools, and they should be now continuous in the workplaces so that staff are aware, and our patients also need to be made aware of their rights. Some do not know, and it is their rights enshrined by the WHO, enshrined international health standards, and even within the country laws. One of them is right access to healthcare. They have a right to access to healthcare, regardless of their socioeconomic status. Even if it is to stabilize and give them first aid before you can refer to a facility of their choice, they have a right to access their healthcare. Secondly, right to quality care. This means that having the qualified staff, expertise, acceptable standards, ethical guidelines, all this, the patient has a right to be attended to by skilled, diligent staff. Rights to information, this information about their proposed treatment, the risks, outcomes, expected outcomes, prognosis, diagnosis, planned care, and be involved in the decision making. Another one is right to privacy and confidentiality. Please ensure that this, when they are, the discussion is happening, there is privacy around, there is confidentiality. It is not easy when somebody is talking about their, describing what is happening to their bodies, and the doctor is, or the medic is trying to find out the diagnosis, come up with a diagnosis. So we need to give them the privacy and confidentiality. Rights to informed consent is another one. They do not give, there are some procedures that require informed consent, some verbal consent, even if it's just taking vital signs or taking your blood pressure. These patients have rights to informed consent, and they need to compliance of that need to be done. Rights to dignity and respect. Again, this is very important. Forms of abuse should not be tolerated, whether physical, psychological, verbal. We even have the special groups that, the mentally ill, the young children, and the mothers in labor, the very sick. All this need to be protected from all forms of abuse. And rights to complain and seek redress. This is very important, and there should be venues and where the patients or clients can complain, whether it is anonymous or whether by giving. So again, this will help you to know the level of care you're giving and measures to improve and become even better. Rights to second opinion. I know some do not like to hear when patients are demanding for second or third opinion, but it is their right for you to be able to give them that. Let them hear from somebody else. If they are not satisfied, let somebody else give their opinion, and sometimes it helps. It really helps, and psychologically the patients now become more receptive of the care that you're giving. The ninth one is access to medical records. Remember, it's about them. It's a legal document, yes, but there is a way they can access their medical records should they want. And of course, as a legal document, even in a court of law, it can be required. So we ensure that our documentation is always right, so that when this happens, you have no problem in complying. The 10th one is right to continuity of care. Our patients, if it is a referral or it is to be seen as an outpatient or other services to continue, again, it is their right to receive this. So it doesn't end only from the time they walk in and walk out, or they pay you and they go. Uh, they have a right to continuity of care. Up to today, we have learned, we are going to improve and look at ways to comply to this in our workplaces, so that the patients will keep coming, so that the care that we give is as required, and so that we are able to comply to this requirement that patients have rights, and we need to look at ways to comply. Thank you.